Okay, welcome back, everyone, from
Steve,
lunch.
hold on, Louise. Oh, it's already recording. Sorry.
No worries, it's okay, Camilla. Welcome back, everyone. Hope you had a nice lunch or a nice break, depending on where you're located. And thank you to those who participated in the chat with the lunchtime activity. At this time, I'd like to introduce Dr. Steve Niemi. You can go ahead and share your slides if possible, Steve. And I'll go ahead and introduce him. He's the attending veterinarian and director of the Animal Science Center for Boston University and adjunct professor in the Department of Comparative Pathobiology for Cummings School of Veterinary Medicine at Tufts University. He's a diplomat and past president of the American College of Laboratory Animal Medicine. And he's here to give us a talk on pathways to continuous improvement. And with that, I'll go ahead and hand it over to you, Steve. Oh, you're muted, Steve.
There we go. How's that?
Sounds great.
Okay. Thank you, Jesse, and thanks to the organizers for this invitation. I was humbled to be included in such a program that has a rich history and certainly offers a lot of promises and opportunities going forward. Dr. Nicolette Peterberry suggested this topic, which I thought was certainly pertinent because it's probably the hardest element in a program that after you've made a few tweaks or changes and you've got some improvements in hand, how do you sustain that and how do you keep that going? This is not going to be a harangue for folks who may have trouble doing this or have been told that what they do is bad and they need to do good. But I am going to offer some suggestions on how maybe to move forward and some background on what's worked in my past experiences. So with that as background, let me see if I can get this to, there we go. So here are my usual notes in advance. Anything I say should be attributable only to me and no one else. Any for-profit firms that are named are only for example purposes, and I have no conflicts of interest to declare in that regard. And finally, nothing I say is intended or even hinted at to become a must or should directive from any outside agency for an institution. So with that as the standard disclaimers, I want to start with a reality check on where we are today, and then talk about barriers to continuous improvement and emphasizing continuous in our particular fields of lab animal care and use, and improvement specifically in the context of the 3 R's. I'll provide some examples of what's worked for me or that I've seen work for others and may be possible in your respective programs. And as is usual in my practice, maybe suggest possibly radical options as well. And I'll finish with a list of examples of where I see there's significant progress still to be made on improvement, whether it is replacement, refinement, or reduction. And hopefully there'll be plenty of time at the end for Q&A before we get to the panel. So it's not all bad. Here's a list of some previous and recent guide updates, although recent is a relative term these days. No one, to my knowledge, knows with any certainty when an update to the guide may be started, may be completed, may be issued. But it's noteworthy, especially for those of us who have been in the game a long time, to take a look back and see how much progress has been made. And so here's a list of some of the upgrades that were made in the most recent guide and perhaps the edition just before that. And so we have come a long way. And as a reality check today, a reminder that if you look at basic or discovery research that involves life sciences, there are replacements that are already in common use. And maybe it's been my experience at the institutions I've had the privilege of working at, but rarely does an AWIC protocol come before the committee that isn't based on some in vitro or computer modeling or other assays before they get to a living animal. And in fact, there's a need for a literature survey, either by academic discipline or biomedical application, or maybe by journal, or maybe by type of host institution. How many papers that go through peer review have or have not in them non-animal methods in addition to the animal models, or have recently relied on non-animal methods to get to the point that particular paper actually makes. And I think this would provide some hard data on some misconceptions that continue to be out there, specifically for academic or discovery or basic research. There's often a tale told that alternatives are available, but not enough people are using them. We'll get to how that may apply to animal testing, but in terms of animal modeling of diseases in the discovery mode, I think there's a much fuller picture that needs to be told. But even though we've done great things and we're seeing great progress every minute, knowledge doesn't stand still. And Bucky Fuller, who's one of my inspirations, decades ago came up with his knowledge doubling curve that is accelerating even as we speak. And that's not just knowledge in the abstract, it's published knowledge, it's patents, it's applications, it's engineering, every field. And specifically, why would our field be any different? So in spite of the guide becoming older and older, and every day it becomes older, it risks losing credibility, there's still plenty of new knowledge, new discoveries, new findings, new considerations that we need to be aware of, and we may want to consider for applying as continuous improvement in our respective programs. The major barrier that I see in those improvements is how we define and apply the concept of standards in our field. So if you go to Merriam-Webster, here's the list of definitions of standard, and I've highlighted two that I think have particular resonance in our field. One is constituting or conforming to a standard, especially as established by law or custom. And then secondly, having recognized and permanent value. So both of these create the impression that we feed on daily, that compliance drives improvement, compliance drives innovation, compliance defines quality, when in fact it's merely the starting line. And I know that ALAC and the regulatory bodies will agree that the minimum is okay, but they would be delighted to see advances and continuous improvement in everything that they oversee. Instead, what we're left with is a very strong motivation to merely follow the rules and not be the one that sticks his or her neck out and perhaps puts their institution at risk from an assurance perspective, from an accreditation site visit perspective, from a USDA surprise inspection perspective. And let's just stick with what's already there and what everybody else is doing, and we'll be safe. So when we talk about standards in our world, we can go to the animal welfare regulations, where standards means the requirements with respect to the humane housing, exhibition, handling, care, etc., for covered species. Many years ago, ILAR Roundtable hosted a workshop on performance standards, and I was delighted to hear representatives of USDA, APHIS, Animal Care speak from the podium that they are happy to consider alternatives in their lingo performance standards, because that was the topic of the workshop. And even though very few people take advantage of that potential flexibility, at least on the regulator side, they're more than okay to consider suggestions and options provided by registered institutions. In the guide, we're all aware that there are two types of standards. There's actually a third, known as a practice standard, that has rightfully fallen out of disfavor, and we could talk about why later. But the two primary ones that everybody wrestles with are engineering standards, which is an input. It's something you can measure. It's a weight, it's a time, it's a temperature, it's a relative humidity percentage. And since those are easily measured, they are very universally embraced, and they, I think, impede consideration of what are described in the guide as performance standards, which are outputs. And one example that many of you have heard me mention before is how often are you supposed to change or sanitize a ventilated mouse cage? On the exact same page of the guide, there's an engineering standard that says every 2 weeks or less, in addition to a performance standard that says that the animal must be provided a cage that is adequate in sanitation, cleanliness, safety, etc. And those can be complementary, but everybody defaults to the one that involves a calendar just because it's easier. Even though the mice, we know, are likely better off if we disturb them less and rearrange the furniture every time we put them into a clean cage with clean bedding. And so that's the hurdle that we all deal with. So our standards, again, in our world, considered fortresses, hurdles, or open doors. And I see them, as long as we use the word standard, as impediments to improvement, whether it's a one-off or it's continuous. And instead of standards, is there an alternative, no pun intended, phrase or label we can use called a performance alternative for local applications? It would still have to be evidence-based. It would have to be data-driven. It would need to be reviewed and approved by that AWIC, but it gets us away from a standard with its implied or adhered to universality. And maybe this will open that door on the right side of the screen and lower barriers to ways to make things better and still comply with not only the letter, but the intent of the guide and other regulations and expectations. So let's get into some proven pathways, at least in my experience. And one place to start is asking animal care staff, the vet techs, the animal techs, the veterinarians, the managers, the supervisors. Are we doing things right? And if not, what would be better? Or are we doing the right things? And if so, what would be even better still? And they're closest to the action. And they've all gotten adequate knowledge and experience to identify where there's room for improvement. If you don't want to ask such sophisticated questions, there's an easier one, and one that I always employ when I'm walking through our facilities. What are we doing that's stupid? What are we doing that doesn't make any sense? Where are we making room for repeat errors or putting the animals at risk when we don't have to. They're the ones that know. They're the ones that have to look at these animals every day. And so one possibility is just to start with those folks who are providing the critical daily care and the veterinary support that these animals need. There's another proven pathway that I've used with success, and it's also asking questions, but it's asking the investigators that are supported by a program, how can we do things better? Everybody talks about satisfaction surveys. I've actually found it more useful to employ dissatisfaction surveys. And when I first did this at Mass General, people gave me very strange looks and were concerned about my continued employment. But in fact, we should be serving our customers with how their research needs evolve, again, within the parameters of appropriate and responsible animal care. And so I'm not interested in what are we doing that is already okay with you? What else are we doing that is making it difficult for you to do your work? So we launched a dissatisfaction survey online with these questions. Which of the facilities are you using? Which species are you using? We had a variety of categories and subcategories that can be grouped around husbandry or facilities and equipment or staff or administrative functions and processes. And we asked investigators to rate their responses to dissatisfaction as never, seldom, occasionally, often, always, or not applicable. And we were grabbing the 3 in red because we didn't want people to think we were gaming the survey and ducking any kind of soft critiques versus the ones that people felt passionate about. And then we provided additional space for comments, and to ensure that we got adequate participation, rather than just provide this and say, please, we offered a $50 per diem credit for each completed survey. And I think we limited this to 8 or 10 per lab. So they wouldn't get a windfall, and not that it mattered, because when we tallied the actual financial cost to our program, we paid out less than $9,000 in credits, which wasn't even a rounding error of our total operating budget. And for those of you who are in even medium and maybe even small size programs, nothing works like giving cash back. And so you might want to consider that as a tactic. Here are the results of that dissatisfaction survey, ranked by those that, when grouped by occasionally, often, or always dissatisfied, were the most common. And you can read these, but when these came back to us and we shared this with the entire research community, I struck the first one because I'm not the one that set price. And so you can talk to my boss if you think that we're charging you too much, but let's look at everything else. And each of these led to a panel or a group or a team effort, including scientists, which was very important, on how do we make it better. The cage and pen conditions referred almost always to mouse cages, where investigators thought we weren't cleaning them often enough. So we issued a second survey, and we provided a series of photographs of a soiled cage over sequential days, and asked the survey respondents, when does that cage look dirty to you? And then we measured ammonia levels, temperature and humidity levels. We looked at animal welfare, and no visual criteria we were already using. And that led to them adopting in their minds what we were already using as cage spot change, early spot change criteria. It was a very nice convergence of opinions, and so on and so forth with these others. Another way to do this is to share the cost and share the expertise. So starting with PIs, if there's a variable that we'd like to explore with a particular model, or we have a question on a protocol that they've submitted, we will offer at our expense, meaning we'll provide the additional animals. We won't charge them per diems. We'll have our folks participate on our nickel for a variety of pilot studies. If we think there might be a better post-op analgesic, let's run an additional small set of mice in parallel with their study or independent of it, and let's look at the data. Are those suggestive that the alternative is better or not, and why? Or is there a better endpoint? Does this have to be a category E outcome? Can we look at something earlier where we can intervene before the animal starts to suffer and use that as something that is scientifically acceptable and certainly better welfare as an alternative? We don't collaborate amongst various programs enough. We certainly have differing circumstances. And so are there pilot studies or experiments we can run with another institution to see if different bedding might have different outcomes, or different gut microflora, which are likely to exist between institutions. They may have a different caging system they've already purchased and are using. We'd like to evaluate that versus ours with particular parameters in mind, because we might be changing vendors for a reason. But before we make a large capital investment, let's run a comparative study. And then finally, which is even more rare, is let's look at another field. Anywhere that animals are maintained in captivity, whether it be for conservation or entertainment or exhibition, are there things that they do that we'd like to know and maybe collaborate on a comparative analysis? And it could be diets, it could be stereotypy problems, and how do you resolve those, or what works in your field versus what does or doesn't work in ours. And so these are just other options to consider. Visit other institutions. And here are just two examples that I've had recently. I was at the Dana-Farber Cancer Institute a few weeks ago to tour their cage sanitation operations, but got a chance to look into some mouse rooms. And they have replaced cage cards printed with a digital battery-operated cage label, which anybody can access and enhance from a laptop anywhere. So scientists are using these now to add data. They may be breeding records, they may be blood collection dates that will tag to a particular cage. What I've highlighted here is this little green light. That's a blinking light that will go on if this cage needs attention. So if an animal tech or a vet tech has seen a health problem in this cage and wants the lab to look at it before any treatments are initiated, you can go into the room and you can look for the blinking lights. And that may sound like small potatoes, but if you're the mouse that's in distress, that needs attention and a verdict sooner, that's a refinement. Or if this is a critical study and before this animal must be euthanized for it being in severe distress, you need that last blood sample. Again, this saves time and puts that animal out of its misery sooner. So for that animal, that's a pretty powerful argument to consider something like this. We sent two of our folks to the University of Houston a couple of months ago to evaluate Dr. David Brammer's program, and observed there that when they change cages, it's with a pair of technicians. Now, it was done primarily for efficiency, but again, two sets of eyes are better than one. So if an animal might have a borderline health problem, when you take that cage out of the rack and it's more easily seen, does that lead to a sooner intervention on that animal's behalf than if you just had a single person changing those cages who may or may not be at that particular instant tuned in to how that mouse is doing. So simple changes, big consequences, specifically for animal welfare. Let me raise a radical option as well. Rather than ask your staff and rather than ask your PIs, you might want to consider what companies for the last 10 or 15 years have been doing, and that's ask anyone on the planet. And this is portrayed in a very nice manner in this book, Wikinomics, where it shows how companies, oil drilling firms that are asking geological engineers anywhere in the world that happen to dial in, where should they drill next? And they've actually had better success than relying on their own geologists, to Procter & Gamble and other companies, which are now putting out an idea that they need a new consumer product, and what might elaborate, or they'll put you on the patent if you respond. And the reason for all of this is because there is talent, there is expertise, and there is interest in a whole lot of other places besides within an institution or between institutions. And when I say anyone, and here's the radical part, I mean anyone. And so rather than sit by and listen to these groups throw animal research under the bus every chance they get, let's invite them in and tell them and ask them, what are their solutions to particular problems we have? I recognize there are huge risks involved because you might be outed and misidentified or misrepresented, and then you're back in the same trenches that you were before. But I've chaired government committees where bench scientists from some of these organizations have presented on non-animal systems and found their science to be sophisticated, to be statistically sound. And with that expertise, let's bring them in and let's share with them what are our challenges or our difficulties or our frustrations or our opportunities, and see what they have to say, with no commitments ensured, no collaborations, but we don't ask everyone else often enough, and maybe it's time for us to start. So let me end by going through my wish list of what's left to improve or what's next to improve. And we have to start with either non-animal methods or microphysiological systems, whatever you want to call them, for non-clinical or preclinical animal testing. And I distinguish this from the basic animal research enterprises that I mentioned earlier. There's a lot of buzz, thankfully, in these technologies. FDA has recently had some laws passed to its benefit that will allow them or encourage them or require them to now consider these with more scrutiny. We're all waiting for what are those guidelines that are non-animal from the FDA that would mirror the guidance documents for animal testing so that we can get a firmer grip on this. But this can't happen too soon. And in fact, I also suggest that we stop calling these alternatives. If you go to the original Russell and Birch document, their 3 R's aren't described as alternatives. They're described as strategies. And when we use the word alternative, we give these initiatives and these platforms less emphasis and credibility, because it implies where you start with an animal system and these are something different. And in fact, they should go in parallel. And as soon as an animal assay is replaced with a non-animal assay, we're all the better for it. Here's another example of what's on my wish list. We've known for a long time that rats are not large mice. Mice are horizontal, rats are vertical in their behavior. Deb Hickman and others have published some excellent papers on that difference and the benefits that happen when rats are given a more vertical housing environment. Manufacturers are now starting to offer these, so we should see if we can accelerate conversion from the lower cage that's been historical, that's on the left, to the cage that provides some standing room for these animals that's on the right. Garrett Lavis has published at length on the retained wildness, that's my phrase, a lot of animals we've domesticated and put into small enclosures when in fact they evolved over millions of years in unenclosed arenas and enclosures. But it's not practical anytime soon or affordable for us to abandon the way we house mice and rats on an industrial scale. But are there ways that we can connect that inherent behavior and need in these animals to maybe current housing? And what I've shown here on the right are optimized cages from Animal Care Systems with an innovation they offer called a block party, which can connect adjacent cages. And when I was at Harvard, we ran a very interesting behavioral pilot where we had 10 cages on a row, all connected by block party tunnels. And each cage could house 5 adult mice. So we had 10 cages. We had a population, we had a community of either 50 males or 50 females on an entire row. And all we wanted to do was see what happened in that kind of environment. No other experimentation was involved. Mice are very clean. And so it was no surprise that 1 out of those 10 cages became the communal toilet. And because mice are very social, all the females pulled every strand of bedding from every other cage into another cage, and that was their bedroom, and that's where they all slept. When we looked at the males, they all designated a communal toilet as well. But perhaps boys being boys, that's where they all slept. And that was a surprise. The other unanticipated finding we had is I had thought with males with more room to roam, there'd be less fighting because there'd be less space, that animals would be crowded together and more places to hide. When in fact, we saw just the opposite. We saw either no change or a slight increase in fight wounds because the dominant mice would sit on top of these tunnels and their entrances into each cage and wait for a subordinate mouse to come through and then beat it up as soon as it tried to enter that cage. And so that was also an unanticipated finding. But this is just an example of how can we serve a social community instinct with mice that we now limit as to their range and as to their numbers. Moving on to animals that have been instrumented for a variety of common laboratory procedures. The dogma right now is once an animal has been instrumented with something that it's going to carry around in a cage, it needs to be isolated. And it may be a chronic indwelling jugular catheter. And in this case, there was an elegant study published very recently, and the final lines of the abstract are paired here, are stated here, that there was no difference in catheter patency between single and pair-housed rats. Certainly a rat that was pair-housed had better welfare than one that was housed in isolation. And the authors suggest, and I'll say encourage, that pair housing is a viable option with rats for chronic vascular implants, and may, or I'll say, will likely improve their well-being. And let's talk about non-human primates with cranial implants. Here's an excerpt from Victor Reinhardt's publication in Caring Hands. This is from part 4. And he asked the question at the beginning of this chapter, isn't it reasonably safe to house monkeys in pairs when they have head cages, head caps, eye coils, or other appliances? His experience has been, yes, it is very safe. And I've heard testimony, and maybe there are publications, that animals in their grooming of each other will actually remove some of the granulation tissue and keep those implants cleaner than doing it by staff that may require restraint in a chair or worse. And so here's another bit of evidence that it's okay to move beyond what's convention and let these animals have social enrichment. And then finally, looking at the Animal Welfare Committee, on which I currently sit, as does Dr. Peterberry. This is through the American Society of Laboratory Animal Practitioners. And I put their mission statement for the society at the top. We're currently deliberating or digesting or discussing what's next that we may want to highlight and move to the board of directors and to the lab animal veterinarian community as well. One of them is the concept of an N of 1 study, which is now occasionally done in human clinical trials, where you may have a very rare condition, and rather than wait to enroll patients, which may take months or years, to evaluate each of those patients one by one in sequence, rather than as a package. And Alan Kasdan at the Yale School of Medicine has published on this. There have been opinion pieces in Nature magazine and elsewhere on N of 1 on the human side. And I think that it certainly has applicability in our world, whether it's a category E endpoint, whether it's animals that are either now extremely rare or extremely unaffordable. And I'm thinking of laboratory macaques. The last price tag I saw on those that are even possibly available is $50,000 to $60,000 an animal. So in light of that, is an N of 1 study design an option where you can start to gather information one by one and collate it later, rather than waiting to bring all these animals into the same study design at the same time. And the other thing that we're deliberating is comparing or contrasting how clinical trials for companion animals is performed versus efficacy studies on lab animals. And in the companion animal clinical trial world, the negative controls that aren't given the new drug or the new medical device or whatever are always required to have the current standard of care provided for them. So whether it's diabetes or cancer, congestive heart failure, so on and so forth, no animal goes untreated and gets nothing. By contrast, our negative controls are almost always given nothing except maybe vehicle, but otherwise everything else is standardized. Can we raise that bar and now start considering how to provide standards of care to compare a novel drug or a vaccine or other medical intervention in a laboratory setting? And with that, I'll turn it over to the audience. Thank you.
Great. Thanks, Steve, for that very interesting presentation. We do have quite a few questions in the chat. The first one is, what if the AR group's answer is don't use animals in research? Can you have a meaningful conversation from that?
Great question. It's been my personal experience at meetings where both camps attend, and they may be alternative congresses or some other things, or maybe a Premier AWIC conference. When I talk to folks from that sector one-on-one, they will admit without being coy that animal research has some value, and that many non-animal systems or microphysiological systems aren't yet ready for prime time. And when I pose to them, well, that's contrary to what your organization touts publicly every chance they get, they look at me with a puzzled, in puzzled surprise, and I don't think they're being disingenuous. I think it's just it's important to have these one-on-ones. There's no guarantee that you're not going to get the same propaganda thrown back in your face, just like we throw our propaganda in theirs. But to me, it's worth trying.
Great, thanks. The second one's more of a comment, I think, regarding encouraging the use of NANs, but no real other regulation has come out requiring it for now. How do we incentivize research institutions to talk to animal rights groups? What is in it for the researcher that outweighs the risk? And I think you kind of alluded to this, but do you want to add any other comments?
Well, based on the public stances and the theatrics, I'd say there's little, if any, value on an institution-wide basis to have those conversations. So that's why neither side invites the other to its conferences, which I think is sad. And when I've asked colleagues and good friends of mine in the protectionist sector, why aren't we invited? The answer I get is they're afraid we wouldn't be treated very well, and that's also sad. This is kind of like diplomacy, where you need to start with personal connections and personal trust, and it is incremental and it's going to be slow. But I've spoken in the past about other fields such as gun rights and gun control, or abortion and right to life. There are very strong opposition stances held, but there are several that will venture out into the middle and have meaningful conversations. And let's find out what elements are there that we can agree on. And there may be 1 out of 1,000. But let's start there again on a personal level, and let's tentatively test the waters and see what we might be able to collaborate on. And don't tell anybody.
Yeah, no, that's a good idea. Starting on common ground to even start that conversation, I think it's going to be productive. Why haven't more people adopted the taller cages for rats? I think this goes back to your slide on the tall versus short cages.
Well, I'll give you 2 reasons at my current institution. One is expense. We haven't put it yet into our capital equipment budget, but it's on my to-do list. And the other is with PI resistance, specifically the people who have dedicated their careers to behavioral research, and anything that's different, because behavior is so complicated and still such a black box, in spite of all we think we've learned. They're very concerned, and rightfully so, that if we give it this animal model a different environment, it's not going to align with their historical controls. And so that's where a pilot study at my department's expense is going to be the tactic that I'm going to approach first. And if it costs us more money to pay for their reagents or their technicians' time, then I can do a cost benefit analysis and speak with my IO, who's very, very supportive, and see what kind of package deal we can put together.
And lastly, why do you think that the dissatisfaction surveys were better, more productive than the satisfaction surveys you mentioned in the beginning?
Another good question, because satisfaction surveys let you off the hook. It's too easy to dwell on what makes you feel good, as opposed to what still needs to be done. And so, as I said earlier, I'm already being paid to serve your needs. But am I serving all of your needs? And the only way I'm going to find out is to ask, what are we doing that irritates you?
Yeah.
At least that was my MO.
Agreed. Okay. Well, thank you so much, Steve, for the great presentation.